Hi, I'm Anna, and for me it's a great pleasure to introduce you today the TDABC in Healthcare Consortium. This is a project that me and Professors Richard and Carisi are working for. Well, the consortium is a collaborative group of researchers and institutions dedicated to improving the quality of projects that apply TDABC method in healthcare and to sharing methodological advances for TDABC around the globe to promote value-based healthcare. But something that is very important is to answer that question. Why TDABC? TDABC is being published and discussed in collaboration with value-based healthcare papers and initiatives. And recently, the TDABC and Healthcare Consortium founders published the systematic review, Advances in Value-Based Healthcare by the application of TDABC for inpatient management, a systematic review. This study demonstrated how studies are using TDABC to estimate cost saving and to show how TDABC can impact value-based healthcare programs. We reviewed 26 studies, and 18 reported that TDABC contributed to value-based initiatives, especially by identifying cost-saving findings. However, we only observed studies focused on surgical inpatient conditions. For me, that result motivate us and other researchers to advance in application of the method for clinical inpatient conditions. Usually, the method is used to evaluate professional and structural costs in the studies. Cost of exams, materials, and medications are not usually evaluated by TDABC, and probably because of the origin of the method, but we can discuss it better in a second moment. Well, this systematic review allowed us to introduce and to conclude that TDABC methodology should be viewed as a gold standard to achieve better cost accuracy and understand healthcare resource allocation, reduce waste, and improve transparency in real-world settings. But it's not only the systematic review. I see the consortium as something that we are starting now, but is an important result, an important step that we are using the systematic review to start, but we are also using our experience that we are developing and we are achieving by the application of TDABC in several studies. Case studies applied especially in Brazil. Our research group has advanced in the application of TDABC in several studies. Cost information, cost saving estimates, and waste reduction opportunities are results achieved by our studies. And what we want to do is to explore how you are conducting that studies, how you are solving our challenges, and how can we engage other researchers, managers, consultants to make the TDABC a powerful technique and solution to contribute to value-based healthcare advances around the world. Well, one important paper that we already published about the application of TDABC is this research that not only evaluated the bone marrow transplant cost in Brazil, but also introduced a framework in 8 steps about how to apply TDABC in healthcare. We see that study as an important contribution of the consortium because the study provides a detailed information about how to follow each step that was introduced by Professor Kaplan once he introduced the TDABC in general for general applications, but what we are doing here is to translate this general application for the specific points of healthcare. And by following the 8 steps, we hope that the researchers can easier to apply the method and also to explore data analysis. For us in Brazil, we also see that study as an important information that we could generate, because we show that we have a huge difference between the real cost of bone marrow transplant in Brazil and when compared with our national reimbursement policy. In a similar way, we did the heart transplant study, and also is the first to evaluate heart transplant costs in Brazil with a microcosting technique. And we could show that the average total cost of 27 patients included was 74,000 international dollars, which exceeds the reimbursement value per patient by 60%. And we see that this real cost assessment can be a very important contribution of TDABC in emergent economies, where we have a financial problem in healthcare systems that deserves our attention as researchers, and deserves our minds to provide better information with more cost accuracy information to support decision makers and new policies to better reimburse the system. Additionally, you have worked hard with telemedicine services. In Brazil, we have a huge project of telemedicine, which is Telesaúde. And we have worked not only with TDABC, but also we are connecting TDABC with lean theory to use the TDABC also to support how to make a telemedicine service more effective. You are redesigning the telemedicine service. You are discussing a lot the capacities of physicians and how can we turn this service more effective and oriented to support what the population is requiring. And this is a project that we have worked hard. We have a lot of questions, and nowadays with what is happening around the world, everything that we advance in telemedicine, in special how to evaluate costs, how to estimate pricing in telemedicine services it's been a great challenge, and we see that you have a lot to do yet on that issue. ABC and TDABC in cancer studies, we see in the literature that we have a lot of case studies published exploring that methods to evaluate real costs of cancer treatment. We recently published also the systematic review where we only looked for TDABC or ABC studies that used that method to evaluate the cost of cancer treatment around the world. And using the results of this systematic review, we justified our case study applied to evaluate the real cost of prostate cancer treatment in Brazil. That paper is under review yet, but yes, we applied the TDABC in our national public perspective to evaluate the cost of prostate treatment in Brazil. And finally, I see as the main contribution of TDABC when we apply the method in multi-center studies. We are working hard to do it, and here we have a spoiler of a few results that we are achieving, but the more advanced studies nowadays are the cardiac interventional procedure and the cholecystectomy guided per video surgery studies. Well, when you are applying TDABC in these multi-center studies, one very interesting and important contribution that you have is that we can explore the method results and also our data to identify the centers, the hospitals that have the the benchmark of process of care. And you can use that data to estimate new scenarios and also cost saving opportunities for the hospitals that are behind the benchmark. And this, for me, I'm industrial engineer, and for me this is amazing, and is where you have the greatest opportunity of TDABC when you are discussing the system, the healthcare system, not only my scenario in my hospital. I'm using here the system to teach, to learn, to study better alternatives, to provide the healthcare service in a more effective way, and consequently with a lower cost. And this contributes to value in our healthcare system. Well, by applying these studies, we have a few highlights here that are interesting. The first of that is evaluating the efficiency of healthcare process from an economic perspective without understanding its behavior may limit the ability to identify practice associated with greater operational performance for healthcare institutions. Value-based healthcare initiatives require investment in technologies to support the ability to control the process of care delivered and its costs. And this highlight is very important. We are trying to work with our technology deficits, but we see that for you advance in real-time analysis of costs with high data accuracy, we need to advance in technologies that support us with time data, cost data in real time, and technology advances to do it. It's very important. And we also see the consortium as an opportunity to connect researchers, health economic researchers with IT and information and informatic also researchers, that we can develop together new technologies, new solutions, and maybe artificial intelligence solutions to turn our models more real-time, more applied, and scalable around the world. Well, the use of TDABC provides detailed information on patients' care trajectory, contributing to support value-based strategies in healthcare, and the estimation of optimal surgical process, or maybe in the future also non-surgical, contributes to demonstrate how advanced methods can support decision makers with high quality information to orient surgical pathways redesign that can be converted in financial waste decrease in healthcare. And for me, this last one, when we think about the healthcare system, if you can join information from different hospitals in the same perspective, can be great for identify opportunities to make the healthcare service better for the population. These studies are under review yet. We're working on the papers, but at the right side here, I have a spoiler for you about how we are working our data and how how can we show that you have a lot of cost saving opportunities when you are comparing the centers, the benchmark centers, with other centers that are a little behind, and you are really showing the cost saving opportunities here. Well, this is a short briefing about the ideas behind the TDABC in Healthcare Consortium, but the idea here is to invite you, that is a researcher or a healthcare manager, to visit our website and subscribe to be with us. We want to create this community to make the use of TDABC more scalable and with a higher methodological rigor that can really can make the method really a very powerful solution to contribute to its value-based healthcare advances around the world. Thank you very much.